Dr. Goldstein's here. We're telling you to get the kids out of the room. We stick Raoul in a closet somewhere. Today we're talking about how endometriosis can cause sexual pain and how to resolve that issue. And Dr. Irwin Goldstein from San Diego Sexual Medicine Alvarado Hospital is back to talk about that. Dr. Goldstein, endometriosis, this is pretty common.
So let's just take 2 steps backwards. You have an organ called the uterus, and actually I brought some models. So these are the 3 organs, the bladder.
Okay. Hold it up for that?
Yeah.
Okay.
Okay, this is the bladder, the uterus, and the back part, the rectum. And if we take this apart, you can actually sort of see into the model.
Right there.
Right there.
Yeah.
So this is the uterus right here, and it has a lining. It's a very special lining because, of course, the baby
that's where the baby
is formed right
is.
Yeah.
Okay.
So that lining connects to the tubes.
Yeah.
Because the egg actually passes down through here.
That's right.
So some of that lining can actually escape into the abdominal cavity and grow. And when it does that, that's the condition endometriosis.
Well, I'll be darned. I've never known that.
Well, now you know
So
that.
what causes it?
Well, we don't know, but it happens in families, very common in families. If you have a first-degree relative, a mother or sister, you'll have a very higher chance, about 6 times more likely. It's about 10 million American women and girls have this condition.
I always thought it was just, is it a disease or is it a situation, or what is it? I mean,
it's
how
cells that are not in their right place, and when
Okay.
they grow, they cause pain. Primarily, this is about pain.
Well, speaking of pain, you know, I always thought, one of my very good girlfriends had endometriosis, and, you know, I always thought it was a cyclical thing. It was like it was just really bad cramps and really bad periods and that kind of thing. But it turns out it translates into your sex life and pain in your sex life.
Right. So
and that's what you focus on.
That's what we're going to talk about. So women who come to a sexual medicine doctor, this uterus has a connection on either side of the rectum to the back part called the sacrum, which is a bone in your pelvis area.
Right.
And if the implants, if these endometrial tissues fall on that ligament, that's called the uterosacral ligament for completeness sake, during sexual activity, the whole thing will move and cause pain.
Oh, no.
So with what we call deep thrusting pain, that would be the kind of pain. So what I want to get through to the audience is that for years it's been sort of a condition that people have and they don't like it and they don't do much about it. So we found that if you go into menopause or if you get pregnant, the endometriosis pain typically goes away. So we know that there's a hormonal component. So doctors have been prescribing hormones that sort of put women, like 20-year-old women, 30-year-old women, into menopause to sort of treat the endometriosis. Well, I call it the tale of 2 cities, the tale of 2 conditions, because by treating the endometriosis with hormones, you're taking hormones away from tissue that really needs hormones. Okay. So you're trading one pain for another pain.
Okay.
And
but I thought that you used hormones to treat endometriosis.
You used hormone ablation. You take it away their hormones. You make them into menopause. That's how you treat.
But you can't do it the other way by giving them more.
Well, if you give them more, you have to treat the endometrial lesions surgically. So that's the hope today, is to share with people that you can have a tiny little incision called laparoscopy, and you could actually destroy these endometrial lesions by looking directly at them and electrically destroying them.
Is that something you do?
Well, it's not something I personally do, but we have experts here in San Diego and in the local region that do a lot of these. Yeah. By taking the endometrial lesions that way and not giving them hormonal ablation treatment, you don't introduce a second problem.
You know, I call that containing your problem. Like whenever I think about things that are happening in life, I say, is this going to cause a second or third order problem?
Yes, so that's
like
what happens.
Rule number 1 is contain your problem.
Okay.
You know, like so don't let it become another and another. You like contain, and that's what you. So the surgery, but what if you don't want surgery? I mean, are there any other options?
Well, so that's the thing. In medicine, we do what's called step care treatment. We start with simple things and then go into more complicated things. For this thing, the simple thing, which is medical, leads to too many other problems. Right. So that's the lesson that we've learned here.
How long? I'm sorry, go ahead.
No, so I think the point is, if you have endometriosis and it's causing you pain during sexual activity, and you come to a doctor, the first treatment really ought not to be to take away all your hormones, but to actually burn and destroy the individual lesions. It's not that difficult. It's done through very special techniques by laparoscopy. You have to be a very skilled surgeon to do that.
And then you can have enjoyable sex again.
Well, then once that's done, the damage that's been done by the hormone treatment that typically is done now can be treated.
Oh.
So I had a woman who was going to come here today, didn't end up coming, but she was going to tell us about how horrible her life had become. By losing her endometriosis, she gained sort of problem two, the tale of two conditions,
Right, and that's
where
how
the
she ended up
second
with you.
condition is brought on by the treatment.
Man, you spread goodwill around this world there, Dr. Goldstein, with what you do, helping people have better sex, basically, and be, just be, it's a wellness thing. You know, your sex life is a, we have to wrap it up and send it back to Erica, but is it not a symptom of your wellness, your sexuality?
It's a quality of life. You share intimacy. It's being a whole person and sharing with another person. It's fabulous, and if you have a problem, really find somebody to help you.
I like it. Dr. Goldstein, thank you very much for being here. I know a lot of people suffer with endometriosis, so thank you for the information. For more with Dr. Goldstein, go to our website, fox5sandiego.com, and click on the Scene On button. Erica, back over to you.